If you're over 60 years old, stop doing these 4 exercises and replace them with these other 4. Many people after 60 years of age start having problems they didn't use to have. Lower back pain, difficulty climbing stairs, knee pain, and so on. The problem is that they have normalized this as something normal to happen, something age-related. And the fact is that it definitely shouldn't be like this. These problems, in most cases, are often the result of doing the wrong type of exercise or no exercise at all. The truth is that at this stage of life, we already have enough experience to know that evolution isn't about doing everything or doing more, but about doing what works in a suitable way. So today you will see not only 4 exercises that can cause problems for people over 60, but also 4 safer options that will target the same muscles without straining your joints. But before we begin, please leave in the comments your name and the city where you're watching our content from. Exercise number 1, deep squats. The deep squat, where you lower until your thighs are parallel to the floor or even lower, is often celebrated as the king of exercises for the legs. And rightfully so, it works virtually all the lower body muscles. However, after 60 years of age, this exercise can become a real villain for your joints. With natural aging, our knees begin to show cartilage wear, reduction in synovial fluid that lubricates the joints, and in many cases, some degree of osteoarthritis. When you perform a deep squat, the pressure on the knee joints increases exponentially. Studies show that it can reach up to 7 times your body weight when we are in the lowest position of the movement. Additionally, natural hip flexibility tends to decrease with age, which means that to compensate for this limitation, many people end up curving their lower back during the movement. This compensation transfers tension to the lumbar region, an area already vulnerable after decades of use. Remember that back pain that appeared out of nowhere? Perhaps it wasn't so random after all. Another common problem is stability. With the natural decrease in muscle mass after 60, body balance is compromised. A deep squat requires considerable coordination and stability. A small failure can result in falls, which represent a much greater risk at this stage of life. I'm not saying this to scare you, but from personal experience, I've seen many students in this age group suffering from chronic pain from insisting on exercises that their bodies no longer accept. And there's more. Blood pressure. During deep squats, there is a significant momentary increase in blood pressure. For those already dealing with hypertension, this pressure spike can represent an unnecessary risk, especially if you're doing the exercise with additional weight. Now let's talk about the perfect substitute, the chair squat. The chair squat is a brilliant alternative that preserves virtually all the benefits of the traditional squat, eliminating the risks. In this exercise, you position a stable chair behind you and perform the sitting and standing movement without necessarily completely touching the chair. The presence of the chair serves as a natural limiter of range and, at the same time, a safety net that drastically increases your confidence during the movement. To execute it correctly, position the chair against a wall to prevent it from sliding. Stand in front of it, with feet shoulder-width apart and slightly turned outward. Keep your chest up, activate your core, and begin the movement by pushing your hips back, as if you were going to sit. Lower until it's comfortable, ideally until you almost touch the chair, and then return to the starting position, focusing on pushing through your heels. The great benefit here is that you work exactly the same muscle groups: quadriceps, glutes, hamstrings, and core, but with much less joint stress. The chair eliminates the need to lower beyond the point where your knees form a 90-degree angle, precisely where joint pressure skyrockets. Additionally, the presence of the chair provides a visual and tactile reference that significantly improves your technique. A common mistake I see is when people let their knees collapse inward during the movement. Always keep your knees aligned with your toes. To start, I recommend 2 to 3 sets of 10 to 12 repetitions with a 60 to 90 second rest between them. As you gain strength and confidence, you can progress to 4 sets. The beauty of this exercise is that it is extremely functional after all. Sitting and standing is a movement we perform dozens of times a day. By strengthening it, you are directly improving your quality of life and independence. Exercise number 2, traditional abdominal crunch. The traditional abdominal crunch, where you lie on your back, bend your knees, and lift your torso toward your legs, is often recommended to strengthen the upper abs. However, what many people don't realize is that during a traditional crunch, there is enormous pressure on the spine, especially in the lumbar region. After 60 years of age, it's common for intervertebral discs to already show some degree of dehydration and natural wear, making them more susceptible to injury. Each repetition of a traditional crunch can significantly increase disc compression, potentiating problems such as hernias and protrusions. Another critical problem is the excessive activation of the psoas iliac muscle, one of the main hip flexors. This muscle originates in the lumbar spine and inserts into the femur, and when vigorously contracted during crunches, it can exert anterior traction on the spine, increasing lumbar lordosis. For people who already have back pain or postural imbalances, this can significantly aggravate these problems. There is also the issue of intra-abdominal pressure. During a traditional crunch, there is a considerable increase in pressure within the abdominal cavity. For those with conditions such as hernias, pelvic organ prolapse, urinary incontinence, or abdominal diastasis, conditions more common after 60 years of age, this increase in pressure can significantly exacerbate these problems. Studies show that excessive repetition of this movement, especially with inadequate technique, can contribute to the development of pelvic floor dysfunctions, a set of muscles that support the pelvic organs. The weakening of this musculature is directly related to problems such as incontinence, which affects about 30% of women over 60 years old. The ideal alternative in this case is the traditional plank. The plank is a brilliant exercise that effectively works all the core muscles, including the abdominals, obliques, transverse abdominis, and spinal extensors, without the risks associated with the traditional crunch. It's an isometric exercise, which means that the muscles are activated and kept in contraction without joint movement, drastically reducing stress on the joints and spine. To perform the plank correctly, lie face down, rest your forearms on the floor with elbows aligned below your shoulders, and hands facing forward or joined. Raise your body, supporting yourself on your forearms and toes, maintaining a straight line from head to heels. The core should be engaged, as if you were pulling your navel toward your spine. Keep the glutes slightly contracted to prevent the hips from dropping. Breathe normally throughout the exercise. To adapt it to the needs of people over 60, there are excellent modified versions. The most accessible is the plank with knees supported, which significantly reduces the load while maintaining the benefits for the core. Another option is the wall plank, where you support yourself with your forearms against a wall, tilting your body diagonally. The more vertical the body position, the lower the intensity. The plank not only strengthens the core globally, but also improves posture, stability, and balance, fundamental aspects for functional independence in older age. Furthermore, being a static exercise, it minimizes the risks of injury associated with repetitive movements. A common mistake is letting the hips be too high or too low, losing body alignment. Always maintain a straight line without arching the spine. Another frequent mistake is forgetting to breathe normally, holding the breath. This can lead to unwanted increases in blood pressure, especially concerning for those with hypertension. For beginners, I recommend starting with 3 sets of just 10 to 15 seconds, with 30 to 60-second intervals between them. As endurance increases, gradually progress to 20, 30, and eventually 45 seconds per set. The goal is not to break time records, but rather to develop control and stability with quality execution. Exercise 3. High-impact running. Many see running as the best cardiovascular exercise, almost like a symbol of youth and vitality. And there's no doubt that running brings numerous benefits to the cardiovascular system. However, for those who have crossed the 60-year barrier, this exercise is not always the wonder it appears to be. What many don't realize is the cumulative impact that decades of physical activity cause on our musculoskeletal system. Every time your foot touches the ground during a run, your body absorbs an impact force that can reach 2 to 3 times your body weight. This force starts in the feet and ankles, propagating through the knees, hips, and spine. Over time, this repetitive impact can lead to a series of problems, especially when our tissues no longer have the same recovery capacity as before. Among the most common problems are shin splints, which is that pain in the front of the leg, patellar tendinitis, Achilles tendon strain, inflammation in the fascia of the sole of the foot, and even stress fractures in the bones of the feet or legs. Additionally, bone density naturally decreases with age, making bones more susceptible to fractures, a risk that simply isn't worth taking. There is also the matter of balance. Running requires coordination and stability, and with the natural decrease in muscle mass and changes in the vestibular system, the risk of falls increases considerably. A fall at 30 years of age might mean a scraped knee. At 60, it can result in serious fractures, especially of the hip, which unfortunately are associated with high rates of complications. There is also an important psychological factor. Many adults feel an internal pressure to continue running, as they associate this activity with maintaining youth and cardiovascular health. They end up ignoring signs of pain and discomfort, thinking of the old saying, "No pain, no gain." This mentality, although admirable in certain contexts, can be dangerous when it leads to ignoring clear signals that the body is sending. I'm not saying you need to completely abandon cardiovascular activities, quite the contrary, just that there are much smarter alternatives. The first of these is the stationary bike. Unlike running, cycling is a low-impact exercise that practically eliminates repetitive trauma to the joints. When you pedal, your weight is supported by the bike's saddle, drastically reducing the load on knees, hips, and spine, precisely the areas that tend to present more problems with advancing age. The only mistake you should avoid on the bike is setting too high resistance from the beginning, which can overload the knee joints, exactly what we're trying to avoid. The bike primarily works the quadriceps, hamstrings, glutes, and calves, practically the same muscle groups as running. However, it does so in a gentler and more controlled way. Additionally, because it's a seated and stable exercise, the risk of falls is completely eliminated. I recommend starting with sessions of 15 to 20 minutes, 3 times a week, at moderate intensity. A good parameter to measure intensity is to think that you should be able to maintain a conversation during the exercise without becoming breathless, but with some effort. Over time, gradually increase to 30 to 45 minutes, alternating between periods of higher and lower intensity. What we call interval training can maximize cardiovascular benefits without excessively increasing exercise time. The second option is moderate walking. Walking regularly strengthens the heart, improves blood circulation, helps control weight and blood glucose levels, and strengthens bones, crucial for preventing osteoporosis. Start with 15 to 20-minute walks on flat terrain and, as you feel comfortable, gradually increase the duration and add routes with slight inclines. Ideally, accumulate at least 150 minutes of walking per week, as recommended by the World Health Organization. Exercise 4. Traditional push-up. The traditional push-up, performed with the body extended and supported only on the hands and toes, is undeniably an efficient exercise for upper body development. However, for people over 60, this variation can present a series of risks. First, the traditional push-up position places a significant load on the wrists. With aging, it's common to develop conditions such as arthritis in the joints of the hands and wrists, making this position potentially painful. Additionally, the stabilization force needed to keep the body in a straight line during the exercise is considerable. With the natural decrease in muscle mass and core strength that occurs with age, many people end up compensating with the lumbar region, which can result in back pain and even more serious injuries. Another critical point is the pressure exerted on the shoulders. The shoulder joint is complex and, after decades of use, can show wear on the rotator cuff, a set of muscles and tendons that stabilize this joint. The traditional push-up, especially when performed with inadequate technique, such as letting the elbows flare out too much to the sides, can aggravate pre-existing problems or trigger new inflammations. Fortunately, there is an excellent alternative, the incline push-up. The incline push-up is a modified version of the traditional push-up that significantly reduces the degree of difficulty and stress on the joints without compromising the benefits for the muscles. In this variation, instead of supporting your hands on the floor, you support them on an elevated surface, such as a wall, counter, table, or the back of a sturdy sofa. To execute correctly, position yourself facing the chosen surface. Place your hands on it at shoulder width or slightly wider. Step back with your feet until your body forms a diagonal line with the floor. The closer to horizontal your body is, the greater the challenge. So start with a more vertical incline and gradually progress to lower surfaces as your strength increases. Keep your core engaged, your back straight, and lower by bending your elbows until your chest approaches the surface. Then, push back to the starting position, focusing on using the chest, triceps, and shoulder muscles. This variation works exactly the same muscle groups as the traditional push-up: chest, triceps, anterior deltoid, and core, but with 2 great advantages. The load on the joints is significantly less, and you can easily adjust the level of difficulty by changing the height of the surface. A common mistake is when people let their elbows flare out too much to the sides during the movement. Keep your elbows at an angle of approximately 45 degrees relative to your body, neither glued to your trunk nor completely open. Another frequent mistake is not maintaining body alignment, letting the hips drop or rise excessively. For beginners, I recommend 3 sets of 8 to 12 repetitions, 3 times a week, with 60 to 90-second intervals between sets. As strength increases, you can progress to lower surfaces, increase the number of repetitions, or add more sets. If you liked this and also want to discover 6 isometric postures that are capable of completely changing the lower part of your body, we have a video appearing right now on the screen. Don't miss it. Thank you for watching this far, and may God bless you, my friend.